Can fine art help physicians and patients better understand illness? That may seem counterintuitive. After all, modern medicine is built on technological progress and innovation. It's true that physicians once needed artists to help them depict anatomy and illness, but today, we have better technology. A medical image like this one, an MRI of the brain, has helped to revolutionize medicine. An MRI reveals what a body conceals by rearranging atoms in our body's tissues. An MRI can detect things like brain tumors, strokes, and spinal cord injuries, things you couldn't see with the naked eye. But an image like this can only show us so much. It can reveal disease, but it can't reveal the person behind the disease. But with the help of fine art, an image like this one has the potential to create meaning for a person who's ill. Now, I admit, I didn't see any of that potential the first time I saw this image. That's partly because this is an image of my brain. Months before it was created, I had lost sensation in my feet and legs, and so I went to a doctor to try to figure out what was going on. After what felt like 100 different tests, my doctor ordered these MRI scans and referred me to a neurologist. Now, when I met my neurologist for the first time, he walks brusquely into my exam room, sits down at his computer, opens up these MRI scans, and looks at them for all of maybe 30 seconds before declaring, "It's MS. You have multiple sclerosis." I was speechless. No one had prepared me for this moment, for anything quite so serious. "How can you be sure?" I asked. "Because I'm a specialist and I know what I'm looking for," he responded. I know. Now that I work in medical education, I have begun to understand how it is that my doctor could look at an image like this and diagnose me without ever feeling the need to talk to me first or even to look me in the eye. Now, medical students will first learn about the human body through textbooks, through images like this. An image like this helps to break the body apart so it can be known in its discrete parts. Of course, you all know that a heart doesn't exactly look like this. It's not this size, hopefully. It's not these colors. It's not still or smooth or two-dimensional. And it doesn't have these little lines sticking out of it telling you about its different parts, though that would be really convenient for medical trainees. Instead, this is the representation of a heart. So our students will learn to see the representation as a stand-in for the real thing. So it's only after you've mastered human anatomy from a textbook that you're allowed to see real patients. It's no wonder then that some physicians are bad at talking to their patients or seeing them as whole, living beings. It's no wonder that some are more comfortable looking at a representation of their patient than they are looking their patient in the face. But it hasn't always been this way. Before the invention of photography and more advanced medical imaging, physicians and anatomists would hire artists to help them depict human anatomy in their textbooks. The famous anatomist Andreas Vesalius and his illustrators, now famous muscle men, depict flayed figures that are rich with metaphors of the divine, the passage of time, and our human mortality. See how this man gestures toward the heavens, acknowledging his creator. See how the background changes as this figure gains more flesh and muscle. Modern medical images no longer seem to point us toward the divine, the human experience, or even the context in which bodies exist. Instead, diagnostic images are fragmented, colorless, fleshless, transparent, and still. Bodies like mine are made into objects in the scanning process so that data can be abstracted from them. As a patient, I had a hard time relating to my MRI. It pulled me apart and showed me in fragments. And I knew that my experience of illness couldn't be perfectly captured in this image, but I didn't know how else to see myself. There was somebody in my life, however, who was capable of seeing something in me and my ill body that I could not. My sister. As an artist, my sister Darian Goldenstahl helped me to see my body differently. Years after my diagnosis, she presented me with this. It's a nude woman frozen in ice. At first glance, it's a bit blurry and hard to make out, but if you concentrate, you can see a female figure in the center of the image. One hand on her head, the other on her hip. She's stiff-looking, sitting on what appears to be a rock. And there are these bright spots floating around the image, representing those spots or lesions on my MRI. My sister titled it Numb, that experience I feel when I'm relapsing. And rather than using a photo of me, she used a photo of herself to represent me. By substituting her flesh for my own, my sister then became part of my story, part of my illness narrative. Rather than using an image to set me apart or to mark me as other or object, her image brings our bodies together. And this image represents something of my experience of illness, which is sometimes cold and alienating, but sometimes radiant and mysterious. And in this image, I was able to see something new, a new image of myself and my ill body that disrupted that ossified image I had held in my head. This convergence of our bodies in print inspired another idea. Over the years, I had amassed thousands of MRIs. The process is such an uncomfortable one for me that I was determined that somebody, besides my physician, should have access to the images produced. Now, if you've had an MRI, you'll know what I'm talking about. So when I get an MRI, they put me in this flimsy hospital gown that's always way too cold for the room. I'm hooked up to an IV for contrast dye, and you lay down on this thin plastic bed, and they strap my head down in this kind of cage so I can't move. The bed then slides into the MRI tunnel, which is way too close to my face. And inside the machine, it plays this loud, erratic, undulating noise that refuses to carry a beat. I've tried. And a single scanning session for me can last up to 3 hours. I have grown increasingly claustrophobic over the years having them done. So I wanted to make something positive out of this rather unpleasant experience. So I got a copy of my latest MRI scans, and I sent a copy to my sister, who was happy to peruse them for artistic inspiration. Now, I had seen my MRIs many times before, but always from behind my physician's head in an exam room. But on my own time, and in the comfort of my own home, I could now appreciate the curve of my spinal column, the folds in my brain, the protrusion of my eyes, and this mashup of internal organs. Some of these images I was familiar with, but some appeared strange to me. My sister and I noticed different things about the images, but by viewing them together, we were coming to a shared understanding. One of our first realizations is that we could use these images to recall that older time in medicine, when bodies were depicted in ways that were deeply theological and pointed toward the meaning of bodies and not merely their objective parts. So the first thing we wanted to do was give flesh back to the images. So my sister invented a way of scanning her skin onto them by dusting powdered charcoal on blank newspaper print and pressing her body into it. And as she lifts, the oils on her skin and the texture of her clothes reveal this bright impression surrounded by a sea of black. The final step is to then layer in the MRI scans using the printmaking process, in this case, lithography. This joining of scan and skin creates a new figure who at once reveals her inner depths and shallow surface for the first time. Like Vesalius's images before, we then wanted to contextualize this figure in her contemporary surroundings, namely the home. Here, this figure stands at the base of steps or gazes through narrow doorways, imagining spaces I may no longer be able to navigate as my chronic illness progresses. Slowly but surely, this art began to change the way I saw myself. Unlike my physician, my sister needed both my image and my illness narrative in order to create the art. And in that process, I began to see my vulnerability and frailty as a gift rather than a problem. The art transforms my woundedness into an opportunity for beauty and communion. Now, my sister recognized, maybe even before I did, that my illness fragmented me, that these MRIs couldn't capture what was most important about me. Medicine's techno-vision pulled me apart, but fine art helped to put me back together. Chronic illness can turn our lives upside down, and there is certainly a place for medicine in our healing journey. But there may also be room for other, more beautiful perspectives. Thank you.